radiation oncologist at Duke University, and I'd like to share with you some of our recent results on a randomized trial using hyperthermia and radiation for superficial tumors. Basically, as part of this trial, patients had to have tumors which were within 3 centimeters from the surface of the body. And most of the patients that we enrolled had a chest wall recurrent with breast cancer. What we did was test these patients to see if they were heatable, and the majority of them were. And we randomized them to twice-a-week hyperthermia with radiation versus no further hyperthermia. And the endpoints were clinical complete response at the treatment site and duration of local control. I'd like to show you an example of the treatments. This is a patient who had a lesion on her back. And you may not see it too well in this picture, but she had actually a tumor within this blue area. And then we put an electron field for radiation therapy purposes with a good 2 to 3 cm margin around that area. We also heated the tumor in that area, and in order to measure the temperature inside the tumor, we placed a catheter, which you can see right here, through the long axis of the tumor to measure the temperatures. Our goal in heating these tumors was to achieve a temperature of about 40 to 43 degrees centigrade for 1 hour in each hyperthermia treatment. And this is an example of the thermometry catheter, and then in addition we do surface thermometry to help monitor the skin temperatures in order to avoid any injury to the skin. The most common side effect with this hyperthermia treatment is a small area of burn, either first or second degree on the skin, but we see that only about 5 to 10% of the time. What was very encouraging to us in terms of the results is that the patient who had the heat treatment had a higher complete response rate. And by that, what I mean is that we had a complete disappearance of all the visible tumor. So you'll see in this graph, the patients who had the radiation alone, about 42 or 43% of those patients had a complete disappearance of tumor. That increased to 68% when we added the heat treatment. And as you can see in these two curves, if the patients were in the high dose arm, they had a better chance of a complete response, and this was also a durable response. Those curves stayed apart.